everybody. Whoop, sorry. Paula here, wanted to come on and share with you guys a really good stretch for the iliopsoas muscle. It is the front of our back is how I put it. It's one of our deepest abdominal muscles, and it connects our lumbar spine all the way up into our shoulder plexus area, down to the inside of your pelvic bowl and down to the inner, into that groin area almost. And so it is responsible for any motion that brings your knee closer to your chest. So chronic sitting, running, walking, everything. And so it's a muscle that really is one of the ones that I view as the most overworked and undertreated muscles in the entire body. So we're gonna go over a nice easy stretch that we can do. A lot of people know of like lunge stretches for stretching out the iliopsoas of the hip flexor area. I prefer doing it when we're laying down on a table or laying down on your bed at home, your kitchen table if you're in a pinch. If you have a high couch, that works really well. I am a fan of doing it the way that I'm going to show you here, more than a lunge, because if we're trying to ask our muscles to relax and engage at the same time, it kind of gives them mixed messages, and it's a different kind of stretch. So it really just depends on what works for you. Some people like really active stretches. I like more of passive stretches. So that's what this is. This is a passive stretch for the iliopsoas muscle group. And I'm going to come up onto the table here. I'm going to first start sitting, but then I'm going to twist my body away. Now, especially if you have low back issues, your inside leg, you're going to keep bent, okay? So we're going to slowly bring ourselves down, and then we're going to scooch our hips over just so that the outer hip is almost off the table. If you don't feel safe doing this, you can angle your body so that your whole body is up here, and you can drop it down easier. But it depends on what you've got going on. So I'll just do this for the purpose of this video. I'm just going to keep myself flush. I'm going to keep this leg bent, anchoring me, and I'm going to hold on just to make sure I'm safe. And then I'm going to slowly bring this, and I'm just going to allow it to stretch off of the table. Now you'll see that it arches the back a little bit. It's usually a sign that this muscle is really tight and it's actually pulling up. And so as we put it down, our back is trying to come up in response. So we can hang out like this. For some people, this will be enough of a stretch. You'll feel it all the way from your knee sometimes, all the way up into the lower ribs area, or sometimes into the chest, depending on what you have going on. Now, if you like this elongating stretch, leave it like this and that'll be fine. But if you want to focus the stretch on just from the belly down into your thigh, like if you know your quads are really, really tight, we're just going to go, and I'm going to go onto my belly here, skin contact. Releasing clothes is all fine and good, but if we can have skin contact, we actually release our tissues better than our clothes. So I'm going to put my hand on my belly here, and I'm just going to slowly sink in to my belly. Now, like we've talked about before, with the myofascial release stretch, we're gently, slowly melting into our tissue. I'm not forcing my way in, but I'm not so light that I'm slipping straight off. So we're just gonna slowly engage in here, and then we're gonna hang out for 3, 5, 6, 7 minutes, and we're just gonna kind of slowly relax. Now, when I first felt it, I felt it going throughout my entire torso into the leg area. But as I hang out here, and I soften and I melt into my abdominal area, I feel it really pinpointing in this top quad area for me. And sometimes you actually even might feel sensations down through the pelvic floor, through the ovaries, or through just the whole genital reproductive organ area. And that's okay. That's that fascial pull pattern, that this tension can also be causing tension across the other pelvic floor area. And sometimes you actually might feel like it heightens or pulls into your low back. As long as it is uncomfortable and you can tolerate it, that's okay. But if it is painful, then you might be stretching too aggressively and you should back off a little bit. Like I said before, that hurt so good sensation is okay, but if it's an ow, 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 let's get away from it, that's not necessarily beneficial for you anymore. So we're just gonna hang out for that 3 to 5 minute mark and let ourselves stretch and open up here. If it's too intense and you need to start off at 20, 30, 45 seconds, start at that and then try again later. I would much rather have you be easy with yourself and respect where your body's limitations at or what your time restrictions are at, rather than just trying to force it because Paula says you have to do this for 5 minutes. Don't. Sometimes your body doesn't like the 5-minute mark. Sometimes it needs to slowly ease into it rather than just trying to go balls to the walls right away. So to come out of this stretch, we're going to slowly engage and disengage our abdominals. We're going to put our hand underneath and slowly help lift our leg up, okay? It's a good idea to stretch over away from it to kind of open everything back up again before getting off the table, because after being stretched down like that for so long, your muscles need a little bit of recovery time before you start moving and progressing with your day. If you just immediately jump up and go through the rest of your day, your body kind of goes, whoa, I was relaxed. What are you doing to me now? And so be mindful and slowly ease out of the stretch and then slowly come up. Now, a lot of people tend to get up with their neck, and I'm just going to show you a different technique here to get up. We lift our hip a little bit, we put our arms underneath our body, and then we push down with our shoulders and our forearms to push ourselves back and create a lever to come up rather than jumping up right away. The other technique would be to roll over onto your side, then push yourself up. So just to be mindful of how we're getting up after doing our stretches, be easy to yourself, and I will see you guys all later.